Hi, my name's Pramila Krishnamurthy. I'm a consultant haematologist at King's College Hospital in London. I specialise in looking after patients who have diseases such as acute myeloid leukemia and myelodysplastic syndrome. And I also look after patients who are undergoing or have had an allogeneic stem cell transplant or other kinds of stem cell transplants. My current project is really investigating a treatment called donor lymphocyte infusion. Donor lymphocytes are a bit like a transfusion of mature cells called lymphocytes from the patient's donor back to the patient after a transplant. And the reason that we do this is to try and prevent relapse, because we hope that by giving these lymphocytes back, we might boost something called the graft versus leukemia effect, where the donor's immune system is able to seek and destroy the cancer cells within the patient. So we routinely use these donor lymphocyte infusions, particularly in patients who've had AML or MDS, but actually we don't have that much data because most of what we know comes from small studies looking back at what's happened to groups of patients. So in the last few years we conducted a randomised clinical trial of different strategies or different ways of giving donor lymphocyte infusion to patients with AML or MDS, which was supported by Leukaemia UK, who collected a number of blood and bone marrow samples along the way. So I plan to look at them with special techniques to understand better the immunological responses of patients who do or don't receive DLI, and to understand what the differences might be between those patients who stay in remission versus those who relapse, and what the effect of donor lymphocyte infusion might be on that. I'm very grateful to Leukaemia UK for being able to see that potential opportunity there in funding a clinician scientist, because there aren't that many of us and there are some constraints or challenges that we have to face that are kind of specific to us. But equally, I think that we have a lot to offer because of the fact that we tend to try and deliver research that's very translational, very kind of working on problems that directly improve outcomes for patients. I was really lucky to be awarded a John Goldman Fellowship in 2021. I feel incredibly lucky because it's so difficult to secure grants at the moment due to the shortage of funding as a result of the pandemic, for example. But I'm totally excited to start this sort of new career path and challenge. I'm really hopeful that we'll open up both new questions to answer and be able to then use the experience that I've gained to kind of address these issues on future research. We really need to raise the profile and explain the importance of our research to the government, to philanthropists, to the general population, so that we can help raise funds that are really critical to developing life-saving treatments. I'm hopeful that we can continue to try and secure that funding, get people to donate, and then secure that funding for sort of life-saving treatment in the future.